Hi, my name is Benji Schreiber. I'm a consultant at the Royal Free Hospital. This message is really out of concern for the community. The patients from the first wave are now coming out of intensive care, those who are surviving. Unfortunately, we've lost a fair number. Already, the Kahila is really relaxing. I'm getting calls from the shops that people are just talking to each other, they're not distancing. I know that people are already going back to all sorts of things, minyanim and men's mikvahs and kids meeting up and chatting on the street and all sorts of relaxing all round. The government is very likely to ease the lockdown to some extent soon, and there's a real fear of a second wave. And we really need to do everything we can to keep strong and to keep restricted in our social distancing. Here's a message from our intensive care consultant, Dr. Buckley, who looked after many of our Kahila members on the intensive care unit at the Royal Free.
I'd like to take this opportunity to just convey how serious a problem this infection is. The pandemic is caused by coronavirus, and whilst the majority of people get a mild illness, there are an unpredictable minority of people that end up being critically ill on intensive care. And despite our best efforts on intensive care, this is a new virus with a new disease that we don't know enough about, and we are unable to save everyone. So if I have any advice to anyone out there or in your community, it is to please listen to the government advice, adhere to the Public Health England advice, and please do not get this infection. This is a killer disease. It is particularly nasty, and no one knows how long it will last. The fact that we may have reached a peak does not mean to say this is the end, and this will go on for some time. I think the end will only come when we have a vaccine. We also need to be prepared for the fact that there may not be a vaccine. A vaccine may well become available in the next few months. It may take a year, it may take a year and a half for a vaccine to be available. Life is precious. Life is a gift. Take one day at a time, and we will look after each other, and we will get through this.
Thank you. And what do you feel about antibody testing? Is that helpful?
So the government are trying very hard to get antibody testing. Antibody testing will be helpful. The 3 million antibody tests that the government bought were not very good, and therefore there's no point in having a bad test that gives you the wrong answer. So as and when we have the right test, it will be very useful. We don't have it yet.
Some people have already done private tests. What do you think of that information?
I understand why people are anxious to take some control over their lives during a period of time where there's no control or a lack of control. I would be very wary of private tests. There are a lot of tests available. We are aware that a lot of the tests that the Spanish government have used are actually quite inaccurate and invalid, and there are many false negative tests. So it says that you either do or don't have an antibody when the opposite is true. So currently, I would not rely on any tests, as the government has not sanctioned any form of testing up to this date.
And what's your advice to someone who's pretty sure they've had the virus already? They might have lost their sense of taste or smell and had the fever. Do you think that he can be more relaxed about having contact with other people?
So I think I understand why people may think that, but without a positive test, we cannot be certain. Surprisingly, there are reports of people getting a recurrence of their infection, which is probably a relapse of the same infection. I cannot tell you that those patients or those individuals are still not infectious. Remember, without the lockdown, the R0 number is between 2.5 to 3. That means the number of people that one infected person will pass it on to. Now, if the R0 number is 3, then if I pass it on to 3 people, and each of those individuals pass it on to 3 people, within 10 jumps, 59,000 people become infected. And if the death rate is 1%, that means 500 deaths. So please, if someone has an infection, because there is a risk of this virus then transferring and leaping 10 times. Saving one life is a precious gift. Please do not put so many people's lives at risk. Please listen to the government's advice.
Another question, we know that people over the age of 70 are being careful, but if someone's in their 20s, 30s, 40s, 50s and generally healthy, are they at risk from this condition?
They certainly are at risk, and it is very, very worrying. And whilst being male, overweight, diabetic, having high blood pressure, or being older are recognized risk factors, some people have the disease and the illness and are very seriously unwell in an unpredictable way. Also, a younger person who gets the infection, even if they are asymptomatic or survive the illness, they then are a risk to others and passing on the infection to others. So the simple advice is, please do not take the risk. Please do not risk your life. Please do not risk passing it on to others and therefore risking other people's lives.